Thank you for joining me today. I see that the topic has generated some interest in the Facebook community, so I'll get to this in about 2 minutes. For those of you who don't know me, I am the founder of Couples Counseling and Associates, my private practice where I have specialized in working with couples exclusively for the past 20 years. I'm also the founder of the Academy for Couples Therapists to help therapists who want to get better at doing work with couples and haven't yet decided on what training to invest in. I believe that couples distress is a public health issue, and doing these free live presentations is my way to pass on to the next generation of therapists my clinical experience so that others can love this work as much as I do. So on to the topic of working with sexual desire discrepancy. I'm going to talk for about 20 minutes, and then if you have questions, you can put them in the chat or in the comment section. And I want to remind everyone that this presentation is not suitable for children. I'm going to be using some explicit language. I will start by talking about what I call Sexuality 101 when it comes to sexual desire discrepancy. I will propose some clinical interventions in the form of questions. And finally, I will give you 2 brief examples from my practice. So I said I will talk for about 20 minutes. Yes, I already said that. Okay. So some of the information here that I'm talking about comes from the work of Marty Klein, Martha Kauppi, Emily Nagoski, and Barry McCarthy. I will also post the notes from this presentation and the video after I'm done. Let's start by talking a bit about what sexual discrepancy is. And I want to start by saying that sex is the adult version of childhood play. Couples are often able to play well when they first meet, but they stop playing often in the second stage of the relationship. And I think of sex as the adult playground when I try to help the couple who is aligned with the goal of increasing or restoring their sexual life, which is not always the case, but I try to help them in creating or recreating a sacred time and a sacred space to allow for that play like they did in the beginning, not how hot it was, but the fact that they created the space and the time for it. And as I said, that's not always the case in terms of their goals. Sexual desire discrepancy is one of the most common presenting problems in couples therapy, whether people present it like that or not. But it's actually not a problem per se. It only becomes a problem because of the meaning that couples attribute to their differences and because of the way they manage their differences. Sexual desire discrepancy is no different than any other difference in couples, but it is more fraught because it triggers sensitive feelings in each member of the couple. It can create a toxic relationship dynamic of mutual blame, leading to an interactional pattern that is difficult to break. The higher desire person sometimes feels rejected and blames the lower desire partner. In some cases, the higher desire partner exerts pressure and in extreme cases, coercion. And the lower desire person blames the higher desire partner for their external pressure and may feel some internal pressure of their own. The higher desire person often feels like they are, quote, owed sex, unquote. And the lower desire partner may feel that they, quote, owe sex, unquote, or, quote, do not owe sex, unquote, to their partner. Alternatively, the lower desire person may denigrate the wishes of the higher desire partner for wanting more sex than they do. Neither of those positions is conducive to play, pleasure, and fun. The more they blame each other, the fewer sexual encounters they have, and oftentimes the less they touch each other. At its best, couples come in early enough when the damage is minor. At its worst, couples come into couples therapy after years of this dynamic marred in resentment and blame, which is the opposite of what's needed for a sexual encounter to occur. The damage can be quite severe, and the longer couples have gone on, the harder it is to change. The longer the couples have gone on with this dynamic, the harder it is to change. So let me make some comments that I call Sexuality 101 when it comes to sexual desire discrepancy. Here I will be making some statements about how I think about sexual desire discrepancy. Many people have erroneous beliefs about normality, arousal, and desire. Most of us didn't learn about sexuality in an informative, straightforward way. Much of what is circulating in our culture about sex and sexuality is based on myth, disinformation, porn use, or bad school education. Bad school sex education, I'm sorry. Most school sex education, for example, doesn't even mention the word pleasure or the word clitoris. Moreover, many people think they ought to know about sexual issues, and they think everybody else knows, even though they didn't get the education. So it would be somewhat strange to figure out why they think everybody knows or they know. They also assume that other people know, as I was saying, even though that is a wrong assumption. But neither of the members of the couple feel comfortable in talking about sex. And I will address 7 issues in this section. They may trigger sexual desire discrepancy as a problem. The first is, there is no such thing as an abnormal level of desire. There is so much variability between human beings and such infinite diversity in the world that I think we're all normal. Number 2, I said I was going to talk about 7 things. Number 2, couples are unlikely to feel amorous at the same time, but most people think that they should. The expectation that desire and arousal should be felt by both partners in the same way and at the same time is often how sexual desire discrepancy first manifests in a couple. Number 3, another expectation is that sex has to be hot, spontaneous, luxurious, and last a lifetime. This is a young adult vision of how sex occurs. This is the second way that sexual desire discrepancy manifests itself. The belief that sex has to be spontaneous and luxurious and last a lifetime goes against the reality that sex evolves, becomes less frequent over time, and that we can no longer use the young adult version of sex. The trouble then begins when couples continue to use their young adult vision of sex. A young adult vision of sex includes several ideas. Instant wetness, for example. Rock-hard erections, for example. Pounding intercourse, for example. Or simultaneous orgasms, just to name a few. Number 4, some partners believe that kissing and other touching activity has to automatically lead to sex. When this doesn't happen, some people feel disappointment. And the disappointment of one member of the couple may lead the other partner to avoidance behaviors. They start to avoid kissing, hugging, and snuggling, believing that once a sexual interaction starts, it cannot be stopped. Make some partners back away from kissing or snuggling because of a fear that it will, quote, send the wrong message and mislead their partner, unquote. Number 5, expecting that all their sexual pleasure should come from the couple interactions as opposed to self-pleasure leads to pressure. And pressure is not conducive to play. Conducive. I keep saying conductive, and I mean conducive. Number 6, most people tell themselves stories that attribute negative meanings to behaviors. Events happen, behaviors happen. He feels like having more sex than she does, for example, and this may bring up some feelings in each, rejection in him or pressure in her, for example. By the way, I'm using the words him and her just for clarity and so that it doesn't get confusing, but the information I'm giving here is for all adult intimate relationships, whether they are heterosexual, same-sex, trans, polyamory, etc. So I was saying that events and feelings are difficult to control, but what we can control are the narratives, the stories we tell ourselves about the events and the feelings. So as I said in the beginning, people make negative interpretations about the behavior of themselves and their partners, and this is what leads to desire discrepancy as a problem. He doesn't like the way I look. She's not interested in me. If he loved me, he would know what I'd like without me having to spell it out. And these are some of the most benign. There are a number of negative interpretations that people make of the behavior and the intentions of their partner. Number 7, and this is the last comment I'm going to make regarding Sexuality 101 for sexual desire discrepancy. Most people say that what they want is to feel pleasure and physical and emotional closeness and intimacy. However, this is not what most people focus on before or during a sexual encounter. Rather, they may focus on how they look, how they smell, how they sound, or they focus on preventing pregnancy, or they focus on whether they want or don't want, or they focus on hurrying an orgasm, or maintaining an erection, or whether there's enough lubrication, or whether they can suppress their emotions and their wishes and their thinking, or whether they're doing, quote, the right things, unquote. No wonder things don't work out when it comes to sexual desire discrepancy. Shame, anxiety, and fear do not align with pleasure, desire, and arousal. So now let me talk a little bit about interventions that can be helpful with sexual desire discrepancy. In general, to deal effectively with sexual desire discrepancy issues, the couple is going to need to become better at 2 things. 1, sexual differentiation, and 2, they need to develop sexual intelligence. By sexual differentiation, I mean that each individual in the couple needs to learn to look inward and figure out what they think, feel, and want, and communicate that to their partner. And they need to be able to manage the disappointment of not getting what they want if their partner can be clear about what they think and feel and communicates it to them. So becoming sexually intelligent means, among other things, that we have the right information, which, as I said, the majority of people don't, the emotional skills to deal with the insecurities, and an increased awareness of how our bodies respond. So they need to know a little bit about physiology and a little bit about the brain. For example, if one partner is anxious, it's very hard to access relaxation. If another partner is resentful, it's difficult to get aroused. Anxiety and arousal don't go together. Resentment and arousal don't go together either. So sexual intelligence also means that we need to figure out how to change our perspective, and it teaches us to become more authentic and more open. So more specifically, here are some questions that I use to guide the therapeutic conversation in couples that present with sexual desire discrepancy. I talk to each member of the couple separately, usually in joint sessions. So the first question is the couple talking about sex? I know that feels common sense, but I can't tell you how many times I find out that the couples therapists I supervise are not talking to their clients about sex, and they're not finding out if their clients are talking about sex, and many of their clients are not talking about sex. So the first thing that I want to say is, if you as the couples therapist help them to talk about sex in the session, that is a good model for them to learn how to talk about sex when they're not in a couples therapy session. So help them by talking about sex in therapy. Even if you're not a sex therapist, you need to be talking about sex in couples therapy. Okay, that was the first question. Are they talking about sex? The second question is, what do they think is normal? I guide my clients in discussing their situation in terms of satisfaction, dreams, and desires. But I explain that the words normal and abnormal, as I was saying earlier, aren't likely to be helpful to the discussion. Almost everyone I know is worried that something about their sexuality makes them deviant, disgusting, broken, or wrong. Partners of all genders are likely to feel shame about not measuring up to societal expectations or to what they themselves think is normal regarding arousal, desire, femininity, masculinity, etc. I also obviously normalize differences between partners. No relationship survives well over decades without the partners discovering significant differences between them. In this case, the difference they experience happens to be about sex, but it's still just a difference of preferences between two people. Desire discrepancy, then, is normal, but most people don't see it that way. Many partners experience shame from having high desire, or low desire, or no desire, or they blame their partners because they think their partners are not normal for having a higher desire or a lower desire. And of course, shame and blame are not conducive, I said it right this time, to pleasure and play. The third question I guide conversations about is, what are their initiation beliefs and routines? Find out about their initiation routines and the beliefs about initiation. Who initiates? How do they initiate? When do they initiate? How do partners know that the other partner wants to initiate? How does another partner respond to the initiator of the first part to the initiation of the partner who initiates? What do they like or dislike about their partner initiation or lack of initiation? Are there gendered beliefs about initiation? Number 4, what are their beliefs about arousal? Find out how they turn themselves on. Ask them, what do you tell yourself to turn yourself on? The lower desire person often says, I have no idea. And the higher desire person often says, oh, he's very hot or she's very hot. Both of those answers operate under the belief that arousal is an external job, which is not always true. Number 5, can they think of sexual activity as having a menu of options? This is an interesting one. Does each member of the couple have a belief that they have a menu of options to choose from? That not all touch leads to sex? That not all sex leads to orgasm? That once they start, it doesn't mean they have to keep going? Can the lower desire person say, yes, not now, maybe later, maybe, or only this way? For example, the lower desire person can say, I'm okay with only a quickie. Or they could say, I can do it provided that the dishes and the kid lunches for tomorrow are done. This is difficult for some lower desire people, even though they can use a menu of options when it comes to other issues. I can stay at the party if we take an Uber home. I can do this or that if we get something to eat first. Why would this be any different when it comes to sex? But it often is. Can the higher desire person be more clear about what they're in the mood for? Do they want naked touch? Do they want help in having an orgasm? Do they want to be watched while they masturbate? Do they have in mind a long, elaborate production, or could they be satisfied with a quick sexual encounter? Help them assess that and communicate that to each other. And help them separate sex from performance and orgasm. And help them separate pleasure from performance and orgasm. Also help them separate touch from sex. Just because they're not having sex does not mean they can't touch. And I can't tell you how often that happens. You can discuss expectations, pressures, what they're each willing and able to do, and their different love languages. Number 6, what are the beliefs about desire? Desire is an inside job. It's a good idea to help each partner create desire within themselves, particularly if they have a tendency to tell themselves that it is their partner to create the desire in them and that it is their job to be initiating. If a partner has to come up with all the desire and all the self-activation toward putting desire into action, and all the self-activation towards putting desire into action comes from only one partner, this could lead to problems. So provide information about the difference between spontaneous desire and responsive desire. Most people have the idea that desire is a spontaneous desire issue. But spontaneous desire refers to sexual desire that appears seemingly out of the blue, whereas responsive desire refers to sexual desire that is prompted by signs of sexual interest, touch, flirtation, or actually starting to have sex. Spontaneous desire is more commonly experienced in the romantic stage of the relationship. Both men and women can experience either one, but it's important to explain the difference. Responsive desire is akin to not feeling like going to the gym when once you get started and you get into it, when you're done, you're glad you went. Spontaneous desire is the one that most people think of when they think about desire, automatically, seemingly without internal input. To summarize, you need to be able to talk about sex with your clients to help them come up with a repertoire of experiences and to help them come up with a reparative experience by talking about it in therapy to provoke shifts in perspective and to end blame. I'm going to take another 5 minutes. There are interactional aspects in sexual desire discrepancy. When you have answers to the questions above, the 7 ones that I just talked about, you will be able to identify the pattern and you will be able to deliver the pattern of interaction to the couple. These patterns occur within any adult intimate relationship, no matter what kind, as I said, and our job is to deliver the explanation of the interactional pattern to them. For example, partner A is not curious about partner B. That hurts partner B, and that makes partner B feel invisible. In turn, partner B is not affectionate with partner A, which makes partner A feel excluded, lonely, or rejected. The less affectionate partner B is, the less curious partner A is, and the less curious partner A is, the less affectionate partner B becomes. That's just an example of an interactional pattern. Another one is the less partner A does laundry, or the less partner A sits down next to partner B and asks partner B about their day, the less desire partner B feels. And the less partner B is willing to engage, the less partner A engages in laundry or emotional connection. So these are just examples of interactional patterns that could get set with rigidity. How do we help turn that around, block the interactional partner? What are they each willing unilaterally to do They each have to do something different. Are they willing? Are they able? What are their roadblocks? So I will end with two brief examples. One couple who presented with sexual desire discrepancy got a lot better and got stabilized pretty quickly when we addressed all these issues that I was just talking about. Information, Sexuality 101. We discussed what they each needed from each other to be able to clear what the lower desire person needed from the higher desire person in order to clear her, quote, to do, unquote, list to become more present in the bedroom. And we discussed how he initiated, how he let her know, how she prepared for having a sexual encounter if she knew in advance it was going to happen. She welcomed his changes, and he was able to make changes of her own. She was able to make changes of her own, including not ignoring his wishes and not denigrating them. You're only doing laundry because you want sex, which a lot of people say is a denigratory sentence regarding the wishes of a partner. It's as if she thought, in this case it was a female, there's something wrong with him for wanting to have sex with her when it's merely an issue of difference. This is how he feels connected, and it's different than how she feels connected, for example. We started discussing the idea that if they wanted a good relationship, neither one could ignore the wishes of their partner as long as they were known. And I spent some time working with her on her mindset, her own exhaustion, and what it was based on, and what she needed from him in order to be more open to playing. And I spent some time with him discussing how her low desire was not an expression of a rejection of him. And when he changed his narrative, he became more open to finding out what needed to be done around the house, how he could contribute more to making her feel more emotionally connected. They each made changes, and they were able to interrupt the interactional pattern. Now, I don't want to give the impression that this is easy. As I said, the longer this goes on, the harder it is to change. The end of blame comes easy to some couples and doesn't come easy with others. Or the change doesn't come at all, even if they don't blame each other. I have a client, that's a second example, where that is the situation. Partner A is not attracted to partner B anymore and is no longer interested in having sex with the partner. We're discussing opening up the relationship. We're discussing one-night stands. We're discussing swinging. We're discussing doing nothing. Neither one of them wants to get divorced, so we're looking at alternatives. They're severely conflict avoidant, but they're grateful for these conversations and sessions. They're becoming more honest, more open, more self-revelatory about their longings, their fantasies, their desires, without the other one freaking out, which is what used to happen. So I consider this a success, even though they're not having sex, but we're having more sexually differentiated and more sexually intelligent conversations. So with that, I'm going to end and wait for questions, and I'm going to stay on for a couple more minutes to see if there are any questions. So I don't see many comments, so I might just tell you that if you change your mind and you want to leave a comment after you watch the replay, feel free to do that, to leave a comment on the group. Thank you so much, and hopefully I'll see you soon. Have a good end of the year.